KU in our hospital, and we have a number of great folks who are with us here today, including the person here on my right, who still is not on my right because he is stealing time out in Colorado. Doc Hawk. Dr. Hawkinson, you out there?
Hi, how are you? I'm good here. It's really nice. Actually, the mask culture is extremely good here. Everybody is wearing masks. There's a lot of people wearing masks outside. A lot of people can't even get into stores or restaurants unless they have a mask on. So that is a very good culture change here, and it's really appreciated. Certainly, whenever you travel anywhere or even going anywhere in Kansas City, a lot of people have anxiety about being safe. So that is one helpful thing here. As far as numbers in the hospital right now, I believe we still have about 18 patients. We have 8 in the ICU and 6 needing ventilators. We did have 2 discharges and no deaths, though, from COVID in the last 24 hours. So that's a very good thing.
That's great. And I love hearing the birds. That's a nice effect right there. And that is not our effect. That's that's Mother Nature's effect. So I think Vince Key is here with us too, lead physician of the Kansas City Royals and one of our outstanding orthopedic surgeons. And in full disclosure, I have supported his household, a shoulder, 3 knees, another knee replacement. There's a lot of stuff out there, Vince Key, you've been able to do for us.
I appreciate you greatly, Steve. You have been an annuity plan since I have 4 kids, so I greatly appreciate that. But on the flip side, your wife has delivered 2 of my kids, so I've contributed just a little bit to you.
Well, thanks for being here. That's awesome, and we're really glad to have you here. Senator Moran, have you been able to join that? Let's just see if you're on. Nope. All right. Well, Dr. Richard Stone is...
Steve, I didn't hear who you said, but Jerry Moran is on.
Excellent. You are on. Are you in the basement again? Has your wife banished you?
I have escaped. She sent me out of the house. Do not come back till the end of the day. She's babysitting.
All right. Well, thanks for being back on the program today. It is always a pleasure to have you with us. You're the chair of the Senate Veteran Affairs Committee. You have a special guest that you've been able to bring to our program today.
I do. Thank you all for letting both of us, Dr. Richard Stone and I, join you. It's a pleasure to be back. I've had a hiatus from the banter between you and Hawkeye for about 2 weeks. I'm ready for some new wit and inspiration. And but I have a guest, so please be on your best behavior. Dr. Richard Stone is the head of the medical department, the medical services of the entire Department of Veterans Affairs. And he's somebody that I have gotten well acquainted with over the last particularly 4 months. Dr. Stone and I and Robert Wilkie, who is the secretary of the Department of Veterans Affairs, have had a conference call each week during COVID-19. So we've been communicating. I would say that the VA has had their opportunity to serve veterans in particular, but they also have what is called the fourth mission. The Department of Veterans Affairs is charged with, in times of a healthcare crisis, when perhaps the private sector, other assets are overwhelmed, the Department of Veterans Affairs by law is charged with the task of caring for non-veterans in a VA setting. And Dr. Stone and I have had a long conversation. I'm an advocate for community care. And so the Department of Veterans Affairs not only cares for veterans in a VA hospital, but also cares for veterans in the community and then pays the bill. So providers at the University of Kansas Health System, from time to time, will have patients who are veterans it's been determined that they should be cared for at KU. And then hopefully the Department of Veterans Affairs provides the check to pay for the services and care for those you serve. Before I turn it over, I guess I'll turn it back to you so you can turn it over to Dr. Stone. I would, perhaps this has been acknowledged in my absence, but Juneteenth and communities across Kansas are recognizing this day. And it is a recognition of the day in which the Emancipation Proclamation was determined to be known, broadcast, publicly aware, particularly slaves, that they were emancipated. And so there's a celebration going on across the nation, and we'll participate in that in a number of areas. But glad to be back and have a conversation. And Dr. Stone, if Dr. Stites introduces you next, I'd appreciate you telling our listeners and the people in this press conference a little bit about yourself and the mission at the VA and how you think things have gone with COVID-19 and what you're expecting. And if you'd like, you're welcome to tell me how I can be of greater help to you, the Department of Veterans Affairs, and particularly to those veterans that we both serve. Dr. Stone is also a veteran himself.
Dr. Stone, did you hear your charge from Jerry Moran? Hey, and thanks, Senator. It is always a delight to have you back on the program, even if you're not in the basement. I guess that's okay. Dr. Stone, were you able to hear that question?
I did, and I thank you, and Senator, thank you for your dedication to America's veterans and to the work that we've been able to do together with the Secretary to really improve access to care, quality of care, and work our way through this pandemic. I am a veteran. I served 23 years in the United States Army. My final assignment was as the Deputy Surgeon General of the Army, where my job was to really run the Army's healthcare system. Was deployed, spent about a year and a half in Afghanistan as one of my longest deployments, and worked to help rebuild the Afghan healthcare system, as well as really run this healthcare system that cared for American service members that were injured in combat. I've been with the VA the last few years, and as the executive in charge, which means that I run the healthcare system for the Secretary and the President. That is 175 hospitals and about 1,200 ambulatory clinics, just about 360,000 employees. And we have been working our way through what the chairman said, what the senator said, the fourth mission, which is really providing a backstop to the American healthcare system as we work our way through the pandemic. We, as of this morning, have about 345 inpatients with COVID-19. About 122 of those are in ICUs. The rest are in our med-surg units. One of the lessons that we've learned is the importance of treating chronic living facilities, nursing homes, which we operate 134 and have a population of about 8,000 veterans in nursing homes, treating them like an acute care institution, in designing COVID-free neighborhoods and COVID-positive neighborhoods, and then segregating our employees in areas that don't cross over and prevent the transmission of COVID. Because of the success that we've had, we've been asked to work in 46 states to help nursing homes as well as state veterans homes to improve their performance and to really protect veterans. We've now touched almost 15,000 American citizens as part of that work. And I have, as of today, a little over 1,000 of my employees out doing consultative work or actually doing bedside work. We've also supported the Navajo Nation, as well as preparing to support the Apache Nation as we work through supporting them in some pretty tough days in some of the hospitals in the IHS as well as the Navajo run hospitals. So with that introduction, I'm really pleased to be here. And I just want to say to you all how appreciative we are of the partnership of our great academic medical centers, as well as your great senator, who is an extraordinary advocate for America's veterans.
Yeah, we're pretty darn appreciative of Senator Moran for sure, and thank you very much for being on the program today, Dr. Stone. And I'll just say, okay, maybe it was a long time ago when I was a medical student and a resident and a fellow, approximately a long time ago. It was just yesterday. And I worked at the VA Medical Center in Columbia, Missouri, and the Kansas City Veterans VA Medical Center here, as well as up in Leavenworth. And I have to tell you what a great experience that always was. And it was an honor to take care of folks and often hear stories from when I started in the World War I veterans and later the World War II veterans. And that is just... that's a really important institution, taking care of folks who have come through the armed services. And we've had some programs here earlier this week and talked a little bit about PTSD and some of the impact and some of the homeless programs that folks here in Kansas City have started, some of our veterans in Kansas City have started. And I think it's really a remarkable story of a community that pulls together. Dr. Key, communities pulling together, are you busy back in the operating room?
Yeah, I am. We're starting to uptick. There's been a lot of hand-wringing, I guess, waiting to see when we were going to start up, but we're starting to ramp up. My practice is pretty large, and I've had a big backlog of patients, so we're trying to work through that, trying to get them on the schedule as soon as we can. So far, everything is working well. Everything that we've done to keep patients safe in the operating room seems to be working well. We're taking extra precautions, obviously, from the preoperative area all the way to the postoperative area. So far, so good.
I'm pretty busy, but hey, Key, I got to ask you something. This stuff under your chin, what? It's gray. When did it turn gray? What happened to you, Key?
It's getting there. I'm getting old. I'm getting old.
Can't get old, man. I got more joints to have you repair. I think you can't get old till my knees are. Who's going to take care of my knees?
I got you covered. I got you covered.
Good. All right. Questions from our audience. Our first media, I think, Jill. I know there are some from the media today. All right. I'm not hearing them. So let's go to our listening audience. We know we have a good audience out there this morning. So what are some of the things that are rolling in?
Kathy wants to know if the virus mimics Legionnaire's disease.
Oh, boy, Dan, I don't know about that one. I've not heard about much mimicking of the Legionnaire's disease or the virus. What do you think?
No, I think other than causing lung infiltrates or the pneumonia type process we see on imaging like CT and X-ray, and of course the inability to oxygenate well, I think that's the only way it would mimic Legionnaire's disease. Again, Legionnaire's disease is caused by a bacteria. This is a virus. A lot of those infections, whether it's bacteria, virus, fungus, can have a lot of the same type of symptoms, a lot of the same imaging findings. Unless there's another specific aspect she's asking about, that would be the only thing I would say is why those two are similar.
Nancy is concerned about a picture that she saw in the paper this morning where they're using fog to clean hotel rooms. She wants to travel. She's worried about those chemicals. Should she be worried?
You know, Dana, I think that fog is probably the same thing we use on our N95 masks, and pretty darn safe when you're cleaning those rooms like that. It kills viruses, kills up bacteria. Probably a good thing.
Yeah, you would expect that if it's a large industry like a hotel industry, healthcare industry, you know, those chemicals are probably vetted by the EPA. Everything is probably registered and all that. So it's known to be safe. We see pictures from other countries as well, of people even fogging or spraying outside, doing those types of things. I would expect that it's probably safe just based on, again, it's a large industry, the hotel industry or whatever industry you're talking about. They're probably using EPA registered or validated products. So I would expect it to be safe, but that's about as far as I know for that knowledge.
Dr. Stone, I'm betting that the Veterans Administration has worked hard to keep veterans safe within the VA hospitals. What are some of the things that have been done there to make sure that the spread of coronavirus does not occur inside a hospital?
Well, I talked a little bit about our COVID positive and in standard zones. That was part of a plan that we released very early. Really, we released it across American healthcare to really divide out areas of the facilities. I think secondly, very early on, we began limiting any visitation in the facilities to keep people safe. But let me come back to an intriguing question, and that is, how do you protect a room and how do you protect areas We've used a number of techniques, including fogging, using various chemicals that are, as you stated, EPA approved. But we've also been using high-intensity ultraviolet lights, especially in the ultraviolet C spectrum, and then following that of testing various surfaces. Been lots of debate about how long the virus survives on various types of surfaces, and certainly your listeners have received much of that. But we've been using both light and fogging in our rooms in order to assure safety, and then following that with frequent surface testing.
Yeah, I think those things
Dr. Stone, this is Jerry Moran. Dr. Stites, can I intrude? What does the VA expect for veterans in Kansas? Dr. Stone, what does the VA expect for veterans in Kansas and Missouri for their ability to have care at the VA unrelated to COVID? How are we doing in our area in opening up services and procedures back at the VA and in the community for our area veterans?
Well, other than Western Kansas, I think we've done really well, and you all have done a great job of really managing your states in order to make sure that the prevalence of the disease has stayed down. And certainly you've got some focal areas and some focal outbreaks that you've dealt with in the western part of Kansas, where the prevalence has been actually some of the highest in the nation in the Garden City area. But for the rest of Kansas, it's done well. So we've been able to progress to reopening a number of our facilities. And when I say that, we never really closed, but we certainly did reorient away from ambulatory services. That has begun to come back very nicely. We started with 20 facilities across the nation, and now we've expanded to 80. And that I would include, when I say facilities, hospitals, and then their ambulatory clinics. So that's gone well. You heard from your other guest about really getting his practice restarted. We refer a lot of care to the community. About a third of the work we do goes out to the community. And we have seen in most areas of the country, including Kansas and Missouri, practices beginning to start, and us being able to get authorizations for care scheduled with clinicians in the community. We have seen some areas of the country where that has not been the case. In the lower eastern seaboard of the United States, a lot of practices have been very slow to open in the commercial space, and we struggled a bit to get people in for care. You know, one of the things we've followed very closely that we've been concerned about is the lower numbers of strokes and heart attacks that we're seeing in emergency rooms. And one of the things we're beginning to see as we bring people in is we really think that Americans have delayed coming in for health care because of concern about COVID. And we're seeing a fair amount of hypertension and diabetes and risk comorbidities that create really some risk for veterans. And we're anxious to get people in safely and really get them in and really care for those disease processes that prevent the complications that all of us are concerned about.
We've certainly seen the same thing here. Our emergency room volume went down 41%. Even as we closed clinics or reduced the clinic volumes and operations in order to preserve our protective equipment, those things are starting to come back, not all the way back yet. Senator, one thing, and Dr. Stone, it'd be interesting to hear from you. So my family is a blended family. We're an interracial family. My wife is African-American. We are doing things to recognize Juneteenth today. The Black Lives Matter movement often, I think, in some regards, is a response to lifelong stress, which we know affects health of whether it's a veteran who's also been to war, or just health of an American citizen. What are we looking at from from the VA perspective? What kind of things are being done to examine some of the issues that are being raised by the Black Lives Matter movement within the VA healthcare system?
Senator, did you want to start with that, or do you want me to go ahead?
go ahead and I'll follow on, please.
Okay. Well, first of all, there's been a lot in the media about our Kansas City facility. As you may be aware, we changed out our leadership in the Kansas facility in the last year or so, and I'm really quite pleased at the new approach that the current leader has taken. They will celebrate Juneteenth today. There's been a number of efforts to really resolve some of the issues that have been portrayed. We have had a number of complaints at that facility, and those complaints have been slow to resolve. I will tell you that this week we've spoken to most of the complainants for the problems that we've experienced there, and I'm quite optimistic that we'll be moving more rapidly to resolve those. I find it completely unacceptable. You know, I grew up and lived most of my professional career in the military, where we were really, I think, the model for American society in the way people should be treated regardless of race or ethnicity. And I will not accept in any of our hospitals any sort of issues like have been portrayed in the media. So with that said, I'm pleased at the number of celebrations and really efforts to bring our community together. And I'm overwhelmingly pleased at the thousands of VA employees who have volunteered to take on missions around the nation. Even to go to some pretty dangerous places when New York City was at the height of its problems, or New Orleans when it was really being overwhelmed. Our employees have continued to do great things, and we will support them. And so, Senator, I didn't know what you want to add to that.
Dr. Stone, thank you for responding. What Dr. Stone is talking about that may be known by all of our listeners, but there have been over the years a number of allegations at the Kansas City, Missouri VA, out on Van Brunt, allegations of discrimination. Those issues surfaced in my mind when a Fox 4, Kansas City Fox 4 news report occurred in March. And we quickly notified by letter the Secretary of the Department of Veterans Affairs. Also, we had the Secretary in Kansas City earlier this year at the World War I Memorial, where he had an opportunity to address publicly and at least oppress that circumstance. And we certainly see our goal. We've had conversations since my letter to the Secretary, with Dr. Stone, and with a whole array of folks at the Department of Veterans Affairs who investigate, who determine, and whose goal and charge is to make sure that there's no discrimination in the workforce. And we've reached out to the NAACP and others, the ministers who have highlighted this issue. And my role is to make sure that I do everything is done to make certain that those allegations are appropriately treated with respect and with consideration, that fairness and the law is abided by, and the VA is in the process of assures us they're in the process of doing just that. So it is an example of where media, sometimes politicians spend a lot of time criticizing the media. In so many instances, the media has been an opportunity for me to know something's going on, or for the administration of the Department of Veterans Affairs, a wide array of government officials to know something's going on that needs attention. And the media serves a very useful purpose in bringing these topics to us. I would say you started, Steve, with your comments about stress and challenging times during COVID-19. The VA is particularly, my number one, I hate to say there's a number one priority. At the forefront of our work in the Veterans Affairs Committee is suicide and mental health. There is a lot of stress associated with COVID-19, but there's a lot of stress associated with military service. Veterans are still committing suicide at 20 times a day. And we're working with the Department of Veterans Affairs to make certain those numbers are reduced. And the goal, of course, is to eliminate them. And so mental health and suicide prevention is our committee's there I go again, is at the forefront of our committee's work. And this week, the White House, the Department of Veterans Affairs, announced their plan in this regard. We've been working with the White House and the Department of Veterans Affairs to make sure that the legislation that Senator Tester and I, the lead Democrat on the Veterans Affairs Committee dealing with these issues, is attended, that they are synchronized, that we're on the same page. If the White House and the committee are together, we have a really good chance of getting this accomplished. And I would say that a significant focus of this effort to reduce suicide and to increase mental health care is to provide support, financial support and otherwise, to people in the field across Kansas, across Missouri, across the country, private organizations, not-for-profit organizations, veterans organizations, to combat mental health challenges and COVID-19. And finally, in the issue of Black Lives Matter, we have focused attention, as does the Department of Veterans Affairs, on homelessness and trying to help those who are in a circumstance with no place to live. The Department of Veterans Affairs has a significant program in trying to reduce and eliminate homelessness. And you could certainly add to the idea of equality and opportunity in this country the myriad of programs, generally known as the GI Bill, that help those who served our country have an opportunity for education and training. And we've expanded that to try to give those veterans an opportunity through their GI Bill support, to start a business. So as we look at ways to make certain that our programs and our policies in this country are supportive of opportunity for everyone, the Department of Veterans Affairs has a significant role to assist in that effort. And I suppose I would add to that, while there are programs, policies, and laws, this still takes morals and the heart and willingness to listen and to learn and to address individually, absent a particular government program, individuals addressing discrimination and racial disparity in our nation. I raised this topic with you and our guests a month ago, Steve, when we were talking about Wyandotte County and the racial disparity in the presence of COVID-19 among blacks.
Well, it's totally real, Senator. We know that many that the number of African Americans and Hispanics as well that have been affected by COVID-19 are far greater than the percentage of the population. And we also recognize that in large part that's due to frontline workers, people who cannot go without a paycheck, still having to go do their job. They can't leave an area where there's a hot spot. And then when they go back home, folks live in closer quartered. Vince Key, even though you have some gray in your beard, you're a black man. Talk a little bit about discrimination as a physician and what you've taught your kids. You mentioned 4 kids. I know what I've had to teach my kids, or actually I had to learn from my wife about what to talk to my kids about. But for you, that's you didn't have to teach. You didn't have to teach me.
No, first of all, like I said, I want to. It's kind of hard to talk about this. I have 4 kids. I have 3 boys. In the African American community, we always talk about having to talk, and I've had to talk. All 3 of my boys are 22, 20, and 17. We've had an incident with he's now 20-year-old who's plays football at Kansas State, pre-med student. 4.3 GPA, 30 ACT, gets pulled over, and I was actually in spring training with the Royals, and he basically got spooked because the police officer had his hand on his gun. So those things are real, and I talk to my boys every day about it. Senator, I went back to, I wrote down a couple of things talking about like your response to Black Lives Matter and talking about the homeless programs and things like that for the VA, which I've looked at numbers and the amount of homeless individuals that are out there, and a lot of them are people of color. But is there something that we're doing within the system itself? We're doing these programs, but is there something else that we're also doing, looking at trying to deal with systematic racism, dealing with this unconscious bias that's out there? I know I'm on this panel. We've had a panel within our department. I was the first African American physician in our department, and we had a discussion about 3 weeks ago, just dealing with just race relations in America. And it was actually probably the best conference that I've been a part of in my 17 years at the University of Kansas. And it was real, it was raw, and those dialogues have to be done. I'm glad that you mentioned about the GI Bill. You know, there's a history of the GI Bill. When African Americans were serving in World War II, you know, some of them came back to countries that really didn't appreciate them. And to me, some of those African American soldiers, or a lot of them, were the ultimate patriots, coming back to a country that didn't really recognize their right to vote or anything else. So there's been this long history of disparities, and there's been this long history of inequities. I think the biggest part is what we're doing now is dialoguing. Do I agree with the riots and things like that? Absolutely not. But Martin Luther King said that the riots are voices of the unheard, and you never wanted to get to that. But the thing is, going out and peacefully protesting is a way that we're going to have to bring this thing to the table. The elephant's already been in the room. The question is are we going to finally have a chance to recognize it?
Well, Dr. Key, thank you for joining us. Thanks for the conversation. I'll use your word, the dialogue with me this morning. I think that what you described is absolutely nothing you said would I find not true. And I'm a student of history. I don't know what that means. I read history all the time, and I've always been shocked, amazed, disappointed, discouraged about those who served our country, who were African American. You describe as some of the greatest patriots ever, and I understand why they deserve that moniker. But yet to return to a country that has such great regard and respect for veterans generally, but not for Black veterans. I've never understood how their service in the military defending our nation didn't have a consequence of different treatment upon their return. So it is a long history. I think what I would say, maybe Dr. Stone would indicate what's going on different today at the Department of Veterans Affairs than maybe 2 weeks ago. From a United States Senate point of view, there is a different level of dialogue, of conversation among ourselves. I think the country realized, and I'm a critic of social media, but just as I indicated, the press has the ability to highlight and bring to the attention of not only elected officials, but Americans, certain circumstances that need attention. Social media brought the case of Mr. Floyd and others to the consciousness of white Americans, to me as a public official, to me as a Kansan. And I think that the response was overwhelming in the country of disgust, of aberration, of perhaps shock, amazement, concern. How could this happen? And as a result of that, I think elected officials are much more serious in the way that they are dealing with racial disparity and racial circumstances in our country. I know what I'm supposed to say, and I know that it's the truth. I need to listen, learn, and respond based upon what people who have experienced these circumstances know and suggest. My outreach to leaders in Kansas in this regard is, I recognize that I need to learn from you. I want to do right, and I need you to help me to know how to do right. And that is it's true of all Kansans. I want to do right for them, and I want them to help me understand what is right. So I do think there's a different attitude, approach, concern. I hope this is not, I think this is a seminal moment in American history in which things change. Perhaps the African-American community has seen those circumstances time and time again without sufficient change. My goal, our goal as Americans should be that we use these moments to have a consequence that lasts longer than a moment.
Absolutely.
So, Dr. Stone, thoughts?
Look, I'm given the honor of running America's largest healthcare system, and I'm responsible for the health and well-being of 9.5 million American veterans, each one of them a hero. And I think that there is health inequity in this nation, and we see that in differences in outcomes of diseases like prostate cancer in Black males versus other ethnic groups, including white males. And I think that one of the things that we have made an absolute priority is to examine, as uncomfortable it is, those inequities and to try and erase them. And I'm really very proud of the fact that in the last 2 years, we have erased the inequity in the survival of prostate cancer in the VA. And it's mainly been from erasing the disparities in the access to care for comorbidities. And when you care for diabetes and hypertension well, without economic disincentive, you can erase many inequities in this nation. We began very early on in this pandemic examining the fact that we are seeing, just like you have said earlier, a larger number of Black males testing positive with COVID, but yet our survival rate appears to be exactly the same, and we're working hard to try and understand that. I have an Office of Health Equity that literally we meet trying to look at how we erase the inequities in American healthcare that you and I both know exist, and to do our part to make sure that in our chosen profession we can erase what is really so negative in some other parts of American society.
Yeah, it is true, and we do have a lot of inequities. Jill, we have a few more minutes for a few questions. Let's go ahead and get a few more in.
Yeah, let's rock through some. Brian wants to know, is the outpatient VA clinic open in Junction City yet? And if not, what does it need to have happen to get it open?
Dr. Stone, how about Junction City? Are we open there?
You know, I have 1,200 clinics, and I can't answer you on that one. But
No
I
worries.
promise you I will get back to you on whether it's open now. Let me tell you what the criteria are. Criteria are that the community has 14 days of downward trend of COVID, that the facility has adequate personnel and adequate PPE to protect both patients and our staff, and that the system around them is not calling upon those personnel to do other missions. But I promise you I will get Junction City and get you the answer to that.
Thank you.
Craig wants to know.
To Brian, we can answer that. We will, of course, do the same thing. I was by the clinic the other day, but it was a weekend, and it was closed on the weekend. But I also would point out, if there's a veteran who is lacking care at the outpatient clinic in Junction City, community care is still available. And if it's in the best interest of the veteran, determined by the VA provider and the veteran, him or herself, the VA can refer, is required to refer that veteran to Junction City Community Hospital or other community providers. And there are a lot of community providers that are back in business. And I've been touting what KU Hospital's healthcare system has told me for weeks. It's the safest it's ever been when it comes to infections and the spread of virus. And if other healthcare providers assure me of that, then we're trying to make certain that we help them get back in business so that patients are served and so that revenues begin to flow in support of healthcare. We put a lot of money not only into VA. The VA received millions of dollars during COVID-19 from the taxpayers, from the borrowers of this country, but we put millions, hundreds of millions of dollars to support hospitals and clinics and other healthcare providers during COVID-19. But the supply of federal dollars, the supply of taxpayer and borrowed money is not endless. And the way we can help reduce the need for that support, that federal support, is to get our patients back into care and their bills being paid. And the VA plays an important component in helping us accomplish that.
Indeed. All right, Jill, time for 2 more questions.
Craig wants to know if masks should be mandatory, and if not, why not?
Should masks be mandatory? Okay, Daniel, I'm going to ask you that one first. I wear my mask in public unless I'm out early in the morning and no one else is.
Yeah, I mean, I think right now there is really good population evidence that countries wearing face masks and making mandatory face mask laws have done a lot better in decreasing the rate of death in patients with COVID-19. I think in confined areas, if you're not outdoors, if you're not physically distancing, I think mandatory masking is probably a very good idea.
Vensky, I'm betting you wear a mask a lot. There's a reason you have to wear one in the operating room.
Yeah, I'm used to it. My face doesn't get claustrophobic. I think it should be. I mean, when I go out in public, I'm wearing a mask. I mean, I'm wearing a mask for myself. My kids, they all have a mask on them when we go out, and so at least in my household, it's mandatory. Before I say, I want to wish everyone a happy Juneteenth. I know that there's some physicians and I are actually getting together for dinner tonight, and I know all of us are going to have masks on. So it's one of those things that just has to be standard, just like and there's good data, like Dana said, in terms of that.
Let me ask this question to our listening audience: Would you feel comfortable if you knew that when you were in the operating room, that the surgeon, the anesthesiologist, and all the folks in that OR did not have a mask on? Would you be okay with that while they're operating on you? I pray you would not be, because that would be a really, really, really bad choice. So if it's not safe for you when you're in the operating room, why do you think it's safe right now in the public when coronavirus, which is deadly, is out there? If it's not safe then, why now? You just gotta think about it. This is not a political issue. The politicization of wearing masks is a sin. It is a sin. Just think about whether or not you want your surgeon to wear a mask when he operates on you. If you're not comfortable with that, you should not be comfortable being around people who don't have a mask on. It's really pretty simple.
That's just good old country boy common sense right there.
Yeah. Well, I am a bit of a country boy, man. That's who I am. I got big ears. I have a big chin. I'm bald-headed, but good Lord. Dr. Stone, any thoughts about that?
No, I absolutely agree, and I think you've taken a wonderful approach to it. We have mandatory masking in our facilities. My family masks. We mask when we go out. Certainly, if you're out and you're outside and there's a potential breeze and you've got appropriate social distancing, there's the ability to take your mask off. But if you can't socially distance, you need to be in a mask. And if you're inside a building, you should be in a mask.
Final question. Tom wants to know, do hospitals and health systems in general have enough PPE to handle a surge?
I'll answer for KU. I think we do. We have been so better positioned today than we were before. It's remarkable. Our supplies are built up. Our processes are built up. And we don't think we're going to be in New York City. We think we're going to increase our number of patients as this society has reopened up, and totally understand why society needs to reopen. No concern about that. My only concern is that people don't wear a mask. You want to help us? Wear the darn mask when you're out in public. Dr. Stone, how about the VA? Are you all ready for another surge?
Yeah, we have a goal as part of this to get to 60 days of materials for protective equipment. We have exceeded that this week, but we also have a responsibility to the rest of American healthcare, And we found many places in the nation really struggling. And so we are also building an additional 180-day supply across our system to make sure we can fulfill our fourth mission. We do see areas that are exploding, like India, with over 1 billion people consuming massive amounts of PPE. We are watching Central and South America and their consumption rates. And we are intrigued with sub-Saharan Africa, which for the most part has done very, very well in trying to understand why. And there's lots of, that's a whole another discussion in another venue. But we will continue to work to make sure that we can effectively fulfill our fourth mission to support y'all should we hit another surge. And we are prayerful that we will all take appropriate protection and that this virus will be inhibited and we will not see the kind of a fall of 1918 type scenario when the second wave was massively deadly in the great influenza, and that this COVID-19 will be dealt with as a single wave. And I don't think it's an absolute that we're going to have a second wave, but we are preparing for it.
Agreed. So any final thoughts from our guest today? We'll start with you, Dr. Stone.
Well, I thank you. I really appreciate the conversation, and I appreciate the thoughtful depth that you've gone into with some tough issues for American society and American medicine.
And thank you for being on. Vince Key, final thoughts today.
I concur. I think we need to be a little bit uncomfortable with, we need to be a little bit uncomfortable in our dialogue. We need to be comfortable with that. We need to be comfortable in talking. And I think empathy is the key. We all have to be empathetic to each other. We all try to find the good in each other, and that's what we need to do.
Well, so true. Hey, brother, watch that gray growing on that chin now.
I'm going to cut it. I'm going to cut it.
Dr. Hawkinson.
Yeah, I think we all need to be thoughtful today on Juneteenth. The George Floyd tragedy started with the accusation of trying to pass a counterfeit $20 bill. The gentleman a few years ago in New York, I believe, who there was he was just selling cigarettes. We'll never understand the evil that is going through the hearts and minds of those people that perpetrated the murder. But moving forward, we have to get through this, and we have to seek justice and do it through love, because nobody deserves to die, no matter who they are, for trying to pass a counterfeit $20 bill, if that was true, or selling cigarettes. Hopefully this was a wake-up call overall in the nation. And I think moving forward, things will change, and I believe they will. And if we continue to seek justice and love, I think we will come out better on the other end.
Senator Moran.
Honored to be with all of you. Thank you, Dr. Key, for the chance to get acquainted with you. My care and treatment at orthopedics at KU has been Dr. Vopat, and I've had nothing but exceptional experiences in regard to the orthopedic crew at the University of Kansas Health System. So thank you all for what you do in caring for all of us. It appears to me I'm pleased, because this kind of conversation that we're having throughout this press conference and is different than it would have otherwise been, suggesting that there is change afoot. And I will continue to dialogue and to be empathetic, as was suggested. And let me take a particular time to thank Dr. Stone. I appreciate him as we deal with him on an ongoing basis in the nation's capital. His commitment to veterans, the effort to increase and improve the quality of care for those who served our country, especially in these difficult times of COVID-19, stepping up and doing more. And then the fourth mission of caring for the rest of the country. Dr. Stone mentioned this, and it didn't get any particular reaction in this group, but the idea of taking on more efforts in the private sector of trying to care for those who are in nursing homes and assisted living and the senior care component of healthcare, that the VA is doing. That's an amazing but a very important undertaking. And I'm grateful for what Dr. Stone is attempting and is doing at the Department of Veterans Affairs. And I very much appreciate him accepting my invitation to join us this morning to have a bit of a focus on the topic of veterans and the Department of Veterans Affairs and their healthcare system. I thought KU was a big healthcare system, Dr. Stites. What Dr. Stone described that's a lot of people, a lot of patients, a lot of employees.
It's a whole lot bigger, isn't it? Well, I want to say a special thank you to Dr. Stone and Senator Moran for joining us. It's always a pleasure. For Vince Key for operating on me and virtually every member of my family and taking such great care of us, including my 87-year-old mother-in-law whose knee is working great. Thank you. And to Doc Hawk for being part of us, part of this program. You know, as you go forth in the weekend, and we have hard conversations. I think Andy Reid of the Chiefs, you all know I'm a Chiefs fan. Andy Reid of the Chiefs said, you got to have big ears. That's not hard for me. I got really big ears. But we have to listen well. And what we really have to listen to is people telling us the truth, not telling us what we want to hear. Whether you're talking about masks, you're talking about race, you're talking about discrimination or health or pandemics or coronavirus, we got to talk truth. Because when we don't, we end up with a lot of stress, a lot of chronic disease, a lot of disparity, a lot of discrimination, and that's not healthy. This is a healthcare program. But things like this, it's really what it's about. It's about our mental health and about our physical health. So stay safe out there. Remember till we meet again, wear your darn mask. There's still no place like home. We'll be here on Monday. We'll see you then.